times health coverage is an essential part of regular day-to-day life, but I think the COVID-19 crisis has really highlighted how essential it is to their health and financial stability. And from the early days as the country was fighting back against the virus, I know that health insurance providers have worked hard every day to make sure that Americans are covered and staying healthy. I mean, we've learned a lot about COVID over the last several months, everything from promising therapies to the power of masks, but there's still a lot that we don't know. And we also know we aren't through the crisis yet. And we know it has touched every facet of our society. So what are we committed to doing going forward? Well, every day we're going to continue to work to ensure that people have access to affordable coverage choices that protects them against pre-existing conditions. We'll continue to innovating with health and wellness programs to work for lower costs and to build a healthcare system that comes out of COVID-19 better and more resilient.
It's an issue, again, that has been top of mind for our community and others. You think about the impact of COVID on communities of color, in particular for Latinos, 30% of cases, but only 18% of the population, right? So a disproportionate impact. We have one of the highest workforce participation rates in the country, yet we are working in industries with one of the lowest offerings of employer-sponsored coverage. And so, marketplace coverage, Medicaid, all of those are critical sources of coverage for our community. And so thinking about, this open enrollment period and what are the, the benefits that folks want to make sure that are included, right, in the plans that they select. And I did want to just go back to what Myra said around sort of premiums. I think too often folks either one, don't think that they qualify for marketplace coverage, or two, think that they don't qualify for APTCs or tax credits, right? And so I think that's a really important piece, especially this year for folks who may have fluctuations in their income or job situation, that they really take that first step and go to the marketplace and see what they may be eligible for. They don't assume, right, that they may not qualify. I think that's really important, especially for this year.
So definitely a lot of things have changed in the way healthcare is delivered. I think the first thing I would stress is most plans do offer telehealth benefits today. And so for people who have been, for very good reasons, not able to visit their provider in person, I think having that access to care virtually has been really critical for people. And that's something that, our members are really committed to offering in the long term. The other thing that's been really important is the importance of COVID-19 testing to make sure that people that do have the virus aren't spreading it to their family and their friends. And so another really important aspect of health coverage has been access to COVID-19 testing without cost sharing. And then finally, the last thing I'll mention is that we were all really anxious and eager to have a COVID-19 vaccine. And again, this is something as part of your health insurance coverage that will be covered without cost sharing when a vaccine is approved and available for everyone to take advantage of. So just a couple of areas that we think are so important for people to be aware of.
The flu vaccines are one really important preventive care benefit that's covered on exchange plans with no copays, no deductibles. Other important benefits that are covered with no copays and no deductibles are childhood vaccines, mammograms for people where standards indicate they should get mammograms. And we know folks have deferred a lot of care during this last year as we've been all dealing with the pandemic. Insurance providers are encouraging people to talk to their primary care doctors, see what preventative care they might have delayed this year, and if they can safely get it, go ahead and get it. And so plans are just reminding folks that all those preventive care benefits are covered at no copay, no cost share on exchange coverage. So if you have exchange coverage today and you've been delaying some routine care, check with your primary care doctor on whether they advise you to go in and get that care this year.
Two, we know that I'll just speak for the Latino community. The majority of Latinos are US citizens, but many live in a household with members who have varying immigration statuses, so mixed status families. And there's both been confusion, but also fear among immigrant families about availing themselves to resources that they qualify for. So I think it's, especially in this moment in time, it's important to be clear about what are the eligibility guidelines so that, again, everyone who is eligible is availing themselves to marketplace coverage. We know, for example, that lawfully present immigrants are eligible for marketplace coverage, while the undocumented and those with deferred action for childhood arrival status aren't. But especially, again, in this moment in time, it's really important to be as clear as possible about who's eligible for what.
And Myra, maybe you could expound on that a little bit. What happens when people, go to the marketplace and get, submit their income in terms of trying to see where they qualify? Right, they might be directed to the individual market, but they might also be directed to Medicaid, depending upon the state.
Exactly, Matt, exactly. And so in your state, there could be several different options for getting help with premiums, help with out-of-pocket costs. When you go to the exchange, if they determine that you qualify for Medicaid, which is likely to have the lowest cost sharing and the lowest out-of-pocket cost for the family to be in the program, they will let you know. So you don't have to worry about knowing the names of all different programs and going to 4 different websites. When you go to the exchange, if you qualify for another program in the state that might get you even bigger savings, the state will help track you to the program that you qualify for. And to Jeanette's point earlier, that in some cases, people might be eligible for coverage sooner than January 1st. Depending on which program somebody qualifies for, they might be eligible for their coverage to start sooner than January 1. So those exchanges are just great resources to go figure out what you qualify for. Also, just a quick note, state Medicaid programs usually have state-specific names like Medi-Cal or Badger Care. And so you may have friends or family that are benefiting from those programs now, but you know it by a different name, and your family might qualify for those programs too. So exchange is the one-stop shopping to figure out what options you have.
The other thing I want to mention is that there is a lot of talk in the news around the election and healthcare, and just a lot of discussion about that. And I think it's really important just to note that this market is very stable. It has been around now since 2014 in this current form. And I think it's important to note that no matter what you read in the news for open enrollment that's coming up on November 1st, it's it's going to be there for you for next year.
If I could just add to Jeanette's point, thank you for raising that. Our network, I mentioned our affiliate network. Many of them have been doing outreach and enrollment these past open enrollment periods. And I recall a story last year from an affiliate in Texas, and they were working with a family who thought that the Affordable Care Act had been repealed. And it was only by word of mouth that someone had directed them to an enrollment assistance. And given that there is so much that's information that's being put out there. And I think just making it clear that regardless of what happens in sort of the immediate term, that the law remains the law, and that folks need to take action during this open enrollment period. And again, just trying to break through all of that and making sure folks have accurate information is so critical, just given that there is also misinformation out there as well.
I'm happy to take that one, Matt. We're all very interested to see what we'll see. We do expect to see some new folks coming into the Medicaid program for sure. The folks that don't qualify for Medicaid, I'm sure we'll see a lot of new folks in the exchange too. So we'll all be watching eagerly for those numbers. I think both programs, we're really going to see how important they are for people when they find themselves without coverage, more so than other times.
Right, and I think what I would add is, that we don't know how not just the rest of the year is going to turn out, but what the economic impact is going to be, especially as the negotiations continue with respect to another COVID relief package, and when assistance might be made available, and what it might mean in terms of individuals who really do need to rely on Medicaid, go to the marketplace. And I think we're going to see some of that, play out, for the rest of the year.